Coming to the next case, a 4-year boy was brought to the hospital with complaints of painful, swollen, and bleeding gums. On examination, petechiae were seen, joints were swollen and painful. Capillary fragility test was positive. Iron deficiency anemia was also present. So now, looking at the complaints, mainly the swollen and the bleeding gums, the capillary fragility test being positive. These two indicate towards the deficiency of vitamin C. So let's see what the diagnosis is. Scurvy. The probable diagnosis is scurvy, which is mainly due to the vitamin C deficiency. Now, vitamin C is a water soluble vitamin which is required for various important functions in the body. Now, this vitamin C is also known as ascorbic acid, and L-ascorbic acid is a water soluble essential vitamin. Coming to the dietary sources, richest source is amla. The other sources are the citrus fruits like oranges, lemon, lime, and fruits like papaya, pineapple, etc. The recommended daily allowance is around 60 to 75 milligram per day. During pregnancy and lactation, and also convalescents and aged people, it is around 100 milligrams per day. Now, looking at the case, the presenting symptoms. What is the biochemical basis for the above signs and symptoms in the child? We know that vitamin C is required for the post-translational modification of protocollagen to collagen. So coming to the important functions of the vitamin C, it is mainly required for the reversible oxidation reduction between ascorbic acid and the dehydroascorbic acid. So now this vitamin C has an important role in collagen formation. What does it do here? It is essential for the post-transcriptional hydroxylation of proline and lysine residues, which leads to the conversion of protocollagen to collagen. The hydroxylation reaction is catalyzed by lysyl hydroxylase and prolyl hydroxylase, which the reaction is dependent on vitamin C, molecular oxygen, and alpha ketoglutarate. Hence, the role of the vitamin C in collagen formation. Now, collagen, we know that it is the most important supporting matrix for the connective tissue, blood vessels, bones, and the teeth. Collagen is rich in hydroxyproline and hydroxylysine, which are responsible for the collagen cross linkages, which confers rigidity and strength to the connective tissue. Vitamin C is thus necessary for the maintenance of normal connective tissue and involved in wound healing. Thus, deficiency of vitamin C leads to abnormal collagen formation, leading to brittle intercellular cement. The capillaries are fragile with a tendency to bleed, and hence the bleeding comes in the presenting case. We know that the case also is presenting with iron deficiency anemia. Now, why this happens? Vitamin C plays an important role in iron and the hemoglobin metabolism. The iron is absorbed in the ferrous state from the intestine. Since vitamin C has the reducing property, it helps in the conversion of the dietary iron to ferrous form, enhancing its absorption from the intestine. It also converts methemoglobin into hemoglobin, that is the ferric form to ferrous form, reduction of the iron from ferric to ferrous form, increasing the oxygen combining capacity of the hemoglobin and enhances the supply of oxygen to the tissues. Vitamin C is also required for conversion of folic acid to its coenzyme form, that is tetrahydrofolic acid. Thus, vitamin C along with tetrahydrofolic acid is involved in the maturation of erythrocytes and also has a role in erythropoiesis. It plays a role in absorption of iron and its storage as ferritin in bone marrow, spleen and liver. Hence, in this particular case, the vitamin C deficiency leads to microcytic hypochromic anemia. Next, coming to the treatment part. How is a case of scurvy managed? Now, ascorbic acid or the vitamin C is given at 1 gram per day for first 3 to 5 days, followed by 300 to 500 milligram per day for a week's time. Then the recommended daily dose is resumed. So this is about the vitamin C deficiency, that is scurvy, which leads mainly to the bleeding gums and the swollen joints.